Greetings and welcome to Personality Disorders Part 2. The, the personality disorders strike back. I don't know. At any rate, so what we're going to do here is actually start with true disorders, talking about the different types. The delightful thing about these is that, like much in psychology, they tend to be named exactly what they are. And they tend to be named evocatively enough that they could pretty much let you know what's going on. For instance, the first one, as soon as I get this to work. There we go. The first one is called paranoid personality disorder. I wonder what the major symptom is for that one. I'll give you 3 guesses and the first 2 don't count. Yes, indeed you do. The primary symptom of paranoid personality disorder is paranoia. People are absolutely sure that everyone is out to get them. People are absolutely certain that they can't trust anyone. It's just lovely, blatant paranoia. Going along with that is the fact that people with this personality disorder tend to assume that any mistakes that are made are not their fault. It's always someone else's fault. Okay? They are never wrong about anything. Okay? They are never at fault. They never do anything bad. They never do anything wrong. Anything that goes bad is someone else's fault, or fate, or chance, or God, or whatever. On the other hand, they bear incredible grudges against people who they think have slighted them, that they think have gone against them, that they think have said bad things about them, whatever. Anyone that they think is not on their side, they refuse to forgive, they bear a grudge, they just want, they're much more suspicious and distrustful. They just want nothing whatsoever to do with that individual. Now, when it comes to the rather broad category of whether these people are in contact with reality, they are mostly. They're pretty much in contact with reality. They understand, that they live in the real world, and they don't generally have hallucinations. They may have delusions, paramount among them, that everyone is out to get them. Remember, a delusion is a belief that is demonstrably false, and yet people hold it anyway. However, people with paranoid personality disorder do tend to be at a higher risk for schizophrenia. Now, we don't know whether that is something that is real, or simply, remember I said schizophrenia is also kind of a grab bag, or whether it's simply that when this gets strong enough, we used to call it paranoid schizophrenia, and now we call it positive symptoms of schizophrenia, or whether it depends on who is actually looking at it as to whether or not it's schizophrenia. It's hard to say. However, we do know that people diagnosed with paranoid personality disorder are more likely to be diagnosed with schizophrenia. Causal factors are even more vague than usual for personality disorders, because how many people with paranoia do you think are lining up to allow scientists to study them? Yep, none. It's very difficult to recruit subjects because they simply don't want to have anything to do, because of course they're certain that the scientist, the doctor, whoever is involved, is out to get them as well. And of course, when everyone is out to get you, then you're not exactly going to be Mr. or Ms. Friendly. There does appear to be a bit of evidence that it may be in some ways biological, as opposed to being learned. It might be genetic, it might be something that's inherited, but it also, at least in some cases, appears to be something that can be acquired. For instance, paranoid personality disorder has been known to pop up in people who have had a head injury. They have a head injury, they have brain trauma, and therefore they start to get more paranoid. It's also found in people who chronically use stimulants. And in fact, an overdose of stimulants has a tendency in and of itself to cause paranoia. Now, that's not paranoid personality disorder, because for a personality disorder, it needs to last longer than just the person being on the stimulant. But indeed, what we're talking about here is maybe the chronic cocaine use causes some sort of long-term brain change, which could definitely cause this. Moving on. We have the schizoid personality disorders. Now, schiz, SCHIZ, basically means split. And in most cases, well, when it comes to schizophrenia, we're talking about a split between the person and reality. And that is also true here for these personality disorders, although they tend not to be quite as extreme. With schizoid personality disorders, people have difficulties forming social relationships. They have difficult being friends. They have difficult acting as a part of a family. They basically have difficulty dealing with other people. They are often seen as cold and distant and uncaring. They oftentimes don't seem to have emotions at all. They almost seem to have what's called a blunt affect. AFFECT, a blunt affect. Affect is the fancy psychological term for emotion. So they may not be showing a whole lot of emotion. They may seem apathetic. They may seem like they don't care. They certainly don't seem to care a lot about other people. Very often, they are unable to take pleasure in other activities, which is kind of sounding a little bit like depression. Except with depression, people can very often show negative. You can see how these are kind of squishy, that these are kind of vague in terms of where they come from. And in fact, a lot of these are probably going to be revised in much the same way that the mood disorders were revised and the health disorders have been revised with time. It will be interesting to see what they turn into. They've only been in the DSM for 40 years. It'll be very interesting to see what they turn into in another 40 years or so. Causal factors, just like the rest of the personality disorders, for the most part, this is where you have to imagine me shrugging as I say, because we don't know, okay? It's not very well studied. We do know it seems to be fairly highly inherited, more so perhaps than the other personality disorders are. We also know that there is a link between people or children, in fact, who show schizoid personality disorder and then later on go on to be diagnosed with autism. And also perhaps with schizophrenia, which brings up the possibility that what we're talking about here is not necessarily a standalone disorder as much as it might be a stepping stone to these disorders, or maybe it's just that people get diagnosed with this first and then later on their symptoms are reevaluated, perhaps by a different doctor, perhaps as time has gone on, and instead of being called a personality disorder, they are now called autistic or they are called schizophrenic. We don't know. It's a possibility. More than most of these chapters, the personality chapter, with possible exception of antisocial and antisocial, are pretty much the chapter of we don't know, maybe. Now, the cognitive therapists, the cognitive theorists, of course, are viewing this as a sort of thought thing, that it's something that happens, it's caused by the way people think about things. And so essentially what might be going on here in terms of what might be going on in causing this, it's less a biological thing perhaps, and it's more of a way of thinking, of not needing other people, of thinking you need to be alone, maybe even seeing other people as not something that you want to have, but as more of a liability. In which case, this might be something that cognitive behavior therapy, CBT, might actually be able to treat in terms of trying to get people to change the way they think, to view others not as a liability, but as an asset. I have no idea how well that's actually worked in practice versus in theory, but I'm certain people are working on it even as we speak. So from schizoid personality disorder, we move on to schizotypal. Schizotypal and schizoid. I did not name these. Don't blame me. Okay? When you're trying to tell these apart, try to figure out a way perhaps to tell them apart. Now, what schizotypal does, this might be a way to remember it, is it's schizoid but more. The way that schizotypal is longer than schizoid. Because what we're talking about here is the person has the not really needing others the same way that they do in schizoid, but we add in cognitive and perceptual distortions, almost to the point of hallucinations. Which is why sometimes this gets considered a subtype of schizophrenia, because these distortions are things that you often see in schizophrenia, and oddities and eccentricities, which is a nice way of putting it, in communication behavior are also seen in schizophrenia. So in the same way that schizoid might be considered a stepping stone to autism, schizotypal might be considered a stepping stone to actual schizophrenia. And again, we're not sure. We're not sure whether that's true or whether it's simply a coincidence, whether these are different things, whether they're similar, whether they're the same disorder to different points. We really don't know. The type of distortions and oddities that we see in people with schizotypal disorders, yeah, I put disder, but it's disorder. Yeah, it's a typo. Are things like magical thinking. That if you think of something, it becomes true. That you sometimes see people do this as sort of a superstition, that if you think about something, it's going to happen, and therefore we shouldn't think about it. If you think about someone dying, it could somehow make them die. Which, of course, is not true, but people believe it. See special meanings in conversation and gestures of others. They overhear someone's conversation. They think it has a meaning to them. They think that there's a hidden meaning, a hidden information that only they can see, that only they can know, that things that have nothing to do with them actually contain hidden messages just for them. They might show oddities in speech, and they also can show signs of paranoia. They might think, for instance, they may go a little closer to a delusion of grandeur, the way a person with schizophrenia would have, by thinking, okay, here we are. We basically, I am a very special person. I am a very important person, and therefore I am getting these messages from other people. They're hiding things from me, but I can tell by what they're saying. There's a message to that. There is a message in the commercials I'm seeing on TV. There is a message in what I am reading and what I am hearing. There is a message in what I overhear, assuming these days you get close enough to someone to be able to overhear a conversation. Again, this is something that you see in people with schizophrenia, but you also see it here. Possible causal factors, as I've mentioned before, there is, it's maybe goes past comorbidity, in that this is something that is often seen in the relatives of people with schizophrenia. We know that schizophrenia is very biological and very inherited. More about that later. Maybe this is a milder version of schizophrenia. Maybe it's a stepping stone to schizophrenia. We don't know for sure. But we do know that there might actually be two types of schizotypal personality disorder. One may be genetic, like schizophrenia. It might be something that's inherited. It might be something that runs in families. But there may also be a second type that is more of a learned, that is more linked to a history of childhood abuse, to a history of early trauma. Now, researchers and doctors used to think that schizophrenia was caused by that, but more and more they're realizing that schizophrenia is purely biological. This may be what they were seeing, assume that this is an actual reality, which may be a big assumption. It might be that in some people who undergo trauma, they saw symptoms of what is now called schizotypal personality disorder instead of true schizophrenia. But that also brings up the whole, how do you tell the difference? Where do you draw the line? And again, that line is very, very vague. And since I'm now out of time, in the next video, we'll move on to more types of personality disorders.